With the recent changes to Part D, there are more vaccinations covered at zero charge than ever before. That being said, you still need to understand exactly how these changes affect you so you don't end up needlessly paying for a vaccine that should come at no charge. Now, most vaccinations are covered under Part D plans, which are prescription drug plans. However, this is a voluntary or optional part of Medicare, so you need to be enrolled in a Part D plan to make sure that you have coverage for these vaccinations. You could also be enrolled in a Medicare Advantage plan that offers prescription drug coverage.
So it is pretty simple. On Medicare.gov, you would simply look for a Medicare Part D drug plan. And of course, that is going to include all the vaccinations that we are talking about in today's video. Now, ordinarily, of course, I would recommend that you put in any prescription drugs that you are taking because that's going to be the major component of the costs of Part D plans. But for today's video, we're just talking about those vaccines, so we're not going to do that. And then it's going to sort by lowest drug plus premium cost. We didn't put in any drugs, so it's really just sorting by premium cost. There are, generally speaking, some rather inexpensive Part D plans, possibly even Part D plans with no monthly premium. If you're somebody that just needs a plan in place for preventative measures or, vaccines, which is the topic of today's video, or even just in case, then you could go for one of those less expensive plans that will also help you to avoid any Part D late enrollment penalties. That way you don't have a gap in coverage. And any of these plans will cover those vaccinations that we're about to talk about. And then, of course, you could also enroll in a Medicare Advantage plan. And all you have to do to make sure that you enroll in a Medicare Advantage plan that offers prescription drug coverage, first you click Medicare Advantage, Part C, find plans. Really, the only thing that you have to do here is go up to where it says drug coverage and make sure that it includes drug coverage. And then it will filter out all the plans that don't include prescription drugs.
Although most vaccinations are covered under Part D, some are covered under Part B. And this is where things can get a little bit tricky. The vaccinations covered under Part B are generally speaking seen as treatment, as opposed to the preventative vaccines of Part D. The tetanus shot is a great example. So the tetanus shot can either be administered as a booster, for example, if you were getting a booster regularly, or perhaps as part of a Tdap if somebody is pregnant, or it can be received in response to stepping on a rusty nail. So if you're receiving the tetanus booster as a preventative service, then that would fall under Part D. However, if you step on a rusty nail and you need to get a tetanus shot, then that would fall under Part B. It's really, really important to understand these key differences because medical billing, especially those coding errors, are extremely common, and you don't want to be hit with a big bill that you can't easily dispute.
So as I've mentioned, Part B is mostly treatment, Part D is mostly preventative. The exception to this is that there are several vaccines that are covered under Part B that are, of course, preventative: flu, pneumonia, hepatitis B based on your risk, and COVID-19. And then you can see here there's an example where things can get a little bit confusing. If a patient gets a tetanus vaccination because of stepping on a rusty nail, then that would be covered under Part B. Now, if you're getting it as preventative, then it would be covered under Part D. And then, of course, Part D vaccines, all Part D plans must offer the Part D vaccinations that are recommended by the Advisory Committee on Immunization Practices. And these must be offered at no cost, although sometimes you do have to pay a fee up front and then get reimbursed. More on that in just a moment. This is a full list. Now, of course, not all of these apply, and basically some of these are age-specific or risk-specific, which you can also see here on this chart. You can see here that there are some vaccines that are recommended at specific doses based, of course, on your age. So it's not like you need to get a polio virus vaccine again if you got it when you were younger, which hopefully you did.
A brief pause here. If you have questions about your healthcare, your Medicare, you can absolutely reach us in the comments below or at the number on the screen. We are licensed health insurance brokers. We're licensed nationwide, and there's absolutely no charge for our services. But we do ask that you make sure to like this video so that we can get this information out there. And of course, please make sure to subscribe to stay up to date as we release these videos on a weekly basis. All right, let's get back to it. Now, with these recent changes, you should have coverage whether it's in or out of network. However, there can be complications there as well.
So as I mentioned, these recommended vaccines are supposed to be offered at no cost. However, sometimes you may have to pay up front and then be reimbursed, which can be problematic. Number one, it's more paperwork and can be a bigger headache. Number two, sometimes it's financially uncomfortable to lay out money up front and then wait to be reimbursed. Now, the easiest way to avoid this, of course, is to have the vaccine administered at the in-network pharmacy. So your doctor would recommend or prescribe the vaccine, the pharmacy would have it in stock, you go there and have it administered, and then the pharmacy bills your Part D plan directly. No payment or involvement from you, except, of course, getting the shot. Now, the other way that this can happen is that your prescriber, your doctor, can actually administer the vaccine. Now, they will bill Part D for the vaccine itself. Unfortunately, they may charge you an administration fee, and then you need to seek reimbursement from your Part D plan. More paperwork. Or you go out of network. Let's say you go to an out-of-network pharmacy. Well, then you need to submit a claim through the portal or however it is that you contact your Part D plan. And unfortunately, again, that is more paperwork. So really, the best way to do this is to just go to an in-network pharmacy and have the vaccine administered there.
Now, if you'd like to learn more about Part D plans and how to pick the best Part D plan in 2025, make sure to check out this video over here. You can also check out our Medicare playlist to learn more about Medicare in general. Of course, if you have questions, you can reach us at the number on the screen or in the comments below, and please make sure to like and subscribe. We'll see you next time.